Hello, everyone, and welcome to Gothenburg Health's podcast. We've done a few of these, or a couple of these internally, but this is the first one that we're going to release to the public.
That's right. So if you're listening to this, it's the inaugural podcast that is meant for people who are interested in the hospital here at Gothenburg, people who live in our community, and also anybody who lives in a body and wants to learn about health. And I think that kind of gets most of our audience, wouldn't you say?
That should, yes.
Yeah. Let's start with introductions. I'll go first. I'm Andrew Knust. I'm the CFO here at the hospital, and I have been here 7 years.
My name is Brady Beecham. I am a family medicine physician. I have a master's degree in public health, and I'm the chief medical officer here at the hospital for the last 2 years, and I've been doing ER here also, and just, this is a great place, and I hope that our podcast will reflect the great quality of the hospital, and we'll do our best on this. But also today we have a guest. So I'm going to let you introduce yourself.
Okay.
Craig, welcome.
I am Craig Johnson. I'm the Director of Rehabilitation here at Gothenburg Health. That's physical therapy, occupational therapy, and speech services. I've been a physical therapist for 26 years, and I've actually been here for 20 years. So happy to be here.
Yeah, thanks for joining us.
Yes.
We are not professional podcasters.
Andrew, I don't think you need to say that because people are going to figure it out as we go. We're doing our best.
Yeah, okay. All right, fair enough. All right, well, let's jump in. What are we going to talk about today?
All right, so one of our goals for this podcast is to talk about the hospital, what's going on around here, but also talk about some health topics. And so it's a really great opportunity, Craig, to have you here because we want to talk about orthopedics.
Yes.
Kind of the bones, sort of, when you learn about the systems of the body as a kid, the skeleton is always at the top of the list.
The building blocks, yes.
Yeah.
Yes.
So bones, muscles, all these things that, play a big role in how our bodies work.
Right.
And a big role in what you do in your work also.
All right. Yes, definitely.
Yeah, so maybe can you start by giving us maybe a brief background of what a therapist's role in a hospital is and how that relates to obviously orthopedics and other things?
Right, and specifically a rural hospital like this, we see in a bigger city, Omaha, Lincoln, you're going to be specializing more. But here in the hospital, we see a wide variety of things. We're working with pediatric kids. We're working with high school athletes that have been injured, weekend warriors, and as well as our senior population. And it's great because we don't have to specialize in anything. We see a little bit of everything here. As far as what a physical therapist does, I mean, if you typically, there's a wide variety of conditions that can be treated with physical therapy, but traditionally what you think of is you sprain your ankle or you hurt your shoulder, you do something like that. If it's not going to get better on its own with ice and, ibuprofen or Aleve, you can contact your doctor, talk to your therapist, get in for some physical therapy. We're going to look for restoration of function. If you're the high school quarterback and you hurt your shoulder, we're going to look at range of motion limitations, strength limitations, try and figure out what is wrong with you, take you through that healing process, and then try to rebuild that strength, range of motion, and function so that you can throw a ball again. In the older population, a lot of times we're going to be seeing you for joint replacement, hip replacement, knee replacement, shoulder replacement. And that, your prior level of function is you want to be able to live in your home by yourself. You want to be able to go play pickleball at the Y. Stuff like that, maybe lower level functional goals, but still really important. The process is the same. We evaluate you, try to figure out where the deficits are and address those directly to get you back to or as close to as possible where you were before that injury occurred. So when we're in the hospital setting also, we're seeing people as an outpatient. That's meaning like you're at home on your own and it's a simple sprain or strain and you're going to come in and see us at the clinic over at the YMCA. Also going to be seeing you on an inpatient basis. If you've had a fall at home or something like that, our staff will come over to the hospital, try and determine what is injured, what deficits you have, try to get you up and going again, stairs, walking, transfers, those type of things. The other thing is the swing bed. You might have a knee replaced in Lincoln, Omaha, Kearney, North Platte. You're not quite ready to go home, so we're that stepping stone in between where the therapist is going to come over, address those same type of problems, primarily prepping you to get back to home on your own. So
I've always really appreciated this about physical therapy, that the goals are a lot more related to kind of practical function-based things. Like, what were you able to do before? What do you want to be able to do? And, so everybody's goals are pretty personalized and
Very
pretty
personal,
tailored.
and it's usually something that they're telling us what the goal is. They I want to play football again. I want to play basketball again. I want to be able to walk around Lake Helen again. Very simple type of things, but complex process getting back to that sometimes. But those are practical is a really good word to describe the goals. So yes.
Because I think a lot of people, when I see people in clinic and, gee, my shoulder, it just doesn't do what it used to do, or my knee hurts and this is new for me. They'll do a lot of studies about, gee, should you have surgery for this, or should you do physical therapy, or what should you do? And I'm always just astonished how physical therapy, really there's no substitute for using your body and trying to find your own strength again and balance. And
The first option I always look at is, how can my body heal itself? I don't want to take pills. I don't want to have surgery, reconstructive things done, knees, shoulders, backs. If I can do it on my own, and you can teach me what I can do to maintain that health on my own or prevent it from happening again, like if your back goes out, that's the best. That's the best solution as far as I'm concerned, is trying to do things to allow you to heal yourself. A lot of times we'll see people, we're really good at, we have a good relationship with the clinic and the orthopedists around here, and we're pretty good at determining, with osteoarthritis, that's basically the wearing out of the articular cartilage on the end of your bones. And I kind of relate it to, buying a set of 80,000 mile tires. Okay. Sometimes if you're coming in and you've got 90,000 miles on your 80,000 mile tires.
Is that recommended?
No,
by tires
it is not.
like that?
And bone does not like to rub on bone. It hurts, it swells, it gets stiff, you get all kinds of problems. So a lot of times, people will come in and they're not sure what that option is. And, by evaluating them and examining them, we'll sometimes do a trial of therapy of a week or so. And if there's not improvement, then we know that we need to push that on for either further imaging or to see an orthopedist and have something more aggressive done. But I always like to take the most conservative route first, if possible, to allow the body to heal itself. So.
And I'm sure your patients really appreciate that. And I want to switch gears a little bit. So far, we've been talking about what your role is, like when people have an injury or they have a surgery, want to get back to a certain level. But what kind of advice can you give people to stay away from the therapy office, especially as it relates to joint and bone health?
Preparation, preventative, going into it with preventative mindset is what I think of. And, strength training is a great thing to do, especially as our population gets older. When you start to lose muscle mass, you start to lose strength, you stop, you lose function. You lose the ability to stand up from a low seated position. You can't walk as far. You are potentially going to fall down the stairs if your legs are too weak. So getting involved in a strength training program, and I'm not talking about bodybuilding heavy weights. I'm talking about reasonable, just stuff that the average person can do on their own. We have a great setup here at the YMCA to go in. And if you don't know what you're doing, you can actually work with a physical therapist, and they can actually structure a program that will work with you and show you how to use the equipment. You can get a personal trainer. But the best advice I have is to start lightly. Don't push yourself too hard. Sometimes people are going to come in and push themselves way too hard with an injury or soreness that's going to make them not want to come back for 2 or 3 weeks. Start light, start slowly. And if you don't know what you're doing, find somebody that can give you some advice on how to safely use that equipment and recommendations. The other thing I have is, if you're doing strength training, make sure you don't just come in and do the same program day after day after day. Take a day or two off in between to allow for recovery. If you are injured when you're doing that type of stuff, pay attention to that. Don't just push through it. Maybe you need to reduce the weights you're doing. Maybe you need to go see your doctor if you do have an injury. But listen to your body and don't push through injuries. As far as youth, the high school athletes, preparing for your season should be 3 to 6 months ahead of when your season actually comes. You don't want to just sit around and do nothing, especially if you don't have a sport in the off season. Sit around and do nothing, and then all of a sudden jump into aggressive, high speed running, jumping, cutting type activities. That's going to cause you to get hurt. So especially during the summertime, stay in shape, go to the conditioning programs at school, work out on your own, but don't just fly into something and thinking, I'm going to be really aggressive as far as my strength training and have it create a situation, whether it's an injury or pain, something like that, that's going to stop you from consistently going. So,
Greg, this sounds like you've had experience with this.
Oh.
You have had patients that fall in exactly the category that you're talking about. Like, I want to do something, I'm going to start, but push it hard, thinking this is how I get going, and end up inadvertently taking a step backwards.
Definitely. And the other thing that we see is generally when you go to physical therapy, when we take you through your program and you do have a good outcome, we're going to give you a home exercise program to do, whether it's for your back or your shoulder or your knee, whatever.
I'm always saying to patients, didn't they show you some exercises in physical therapy?
Right.
You could start doing those again. Oh, yeah, I guess I did.
Right.
And
It's such a, it's easy to put off when you don't have any pain. When you're back to doing what you normally did, you're like, why am I doing this stuff? But if you have a bad back, if you've herniated a disc or had surgery and you've had some problems, and you did rehabilitate and got through that process, if you don't keep doing that, again, I've had patients 6 months, a year later that will come back to the clinic. I'll do an evaluation of them and I'll pull up on the computer their last time they were there, and it's the exact same problems. And the exercises we're going to use to treat are the exact same exercises. So honestly, my thoughts are if they would have done that program, and they're usually honest, they say I did it for a week and then I threw it away. If they would have done that program, most likely they wouldn't have had to come back. I think that definitely would have improved their chances of not getting re-injured. So prevention, yes.
I think when I first started doing my role as a doctor, I didn't really understand what physical therapy did a lot. And so I'd have patients who say, oh, my knee hurt. And then, send them to physical therapy, and they'd come back and say, well, they hardly even worked on my knee per se. It was more about my legs and strength training. And so it took me a while to kind of recognize that so much about protecting joints is also looking at the part above and below and strengthening these other muscle groups and just kind of staying in shape. So what about somebody who hasn't injured themselves in their pursuit of better health and have the opportunity to come visit you and get a customized program? Are there just some general things that either resources that people can look at or just general things? I mean, I even hear conversations about walking. Walking is a great exercise. It brings in a lot of muscle groups. If you don't know what to do, just go out and get some steps.
Walking.
Where do you kind of tell people just who are, I'm getting started, I don't know what to do, what should I do first?
If I had to pick two exercises or modes of exercise that people could do that are generally safe, and it's not safe for everybody, and I'll try and bring that up, but walking and pool, swimming, walking in the water, all those are fairly low impact. The pool you can use for a variety of exercises, just using the viscosity of the water as resistance. But there are, if you have a significant medical history, whether it's back problems, leg problems, whatever, walking may not be the best exercise for you. An example I have is somebody that's got severe lumbar stenosis in their back, and the doctor told them you need to just get out and walk and get more exercise. Well, if you have stenosis in your back, walking may not be a good thing, because that's going to be putting your back into extension, which is going to cause compression of your nerves or your spinal cord and make your symptoms worse. You would actually be better off doing a back exercise regimen to open up your spine as best as possible, and then possibly using a new step recumbent stepper for strengthening of your extremities without compressing nerve tissue.
I think that sometimes people do have this idea that, like, I need to go till it hurts, and that's really not the modern advice, correct?
Right, especially when it comes to nerve pain. I tell people, if you've been in an accident or you had an injury that's soft tissue, muscle or tendon or something, you can push things a little bit. I tell people never to go any more than a 3 or 4 out of 10. But if it's nerve pain and you decide to push through it, mowing your lawn or something like that, generally you're going to wake up the next day with a huge spike in your pain, and it's going to take a while to get back down again. So, yeah, it's always a good idea to listen to your body, listen to your pain. And like I said, if it's a If it's a muscular problem, I'd say a little bit of discomfort is okay. But if you're getting nerve symptoms, pain radiating down your legs, what you're doing, you need to try to stop and avoid that as much as possible. So.
Yeah, and when you say nerve symptoms, those would often be things that start in one place and go someplace
Right.
else.
Your back hurts, and then all of a sudden your right leg is asleep.
Yeah.
Yes, that would be a good example.
So my grandpa used to tell me just to rub dirt on it and suck it up. Is that an antiquated
Studies have
approach?
shown that that is not an effective means of treating most injuries.
Okay.
Dirt and suck it up. I don't know. It sounds like it's probably got some
Right.
logic to it. Don't you think? Don't you think?
It might
Greg?
help if you're below the age of 5.
Okay.
Okay. It might apply to that. I'm not sure.
Okay, but what about some of this other advice? Oh, stretch or drink 8 glasses of water. What of this stuff is kind of logical or based in science?
Right, well,
what can we do to give ourselves the best opportunity for success?
Our muscles are composed of 76% water. So that's very important. It's using that to get rid of waste in your body. It's using it to actually transport oxygen and glucose to your muscles to use as energy. It's very important to stay hydrated. It's recommended to drink, FDA is recommending 3 liters of for men and 2 liters for women per day.
I don't know what does that translate into a cup.
I don't.
It's a lot of cups. Okay, here's how I advise people
Okay.
in clinic, because they say, how
Yeah.
do I know when I'm drinking enough water?
Right.
And what I find the interesting answer is what color is your pee?
Right.
Because your pee should look pretty clear, and if it's looking yellow or smelling real strong,
Right.
you need to stay better hydrated.
Right.
So you talk about kind of practical things in physical therapy. That's a
Right.
practical thing in clinic. So.
Right, definitely.
Yeah.
No, it's very important. It's going to help reduce your likelihood of injury, cramps, all kinds of problems. So definitely important to stay hydrated.
Stay hydrated.
Right.
There's never maybe you can
Yes,
have
you
too
can.
much water. It would be a little unusual to
Yes,
get
you can.
there.
You can drink too much water. It's not good.
That's a true statement. You can drink too much water, but I think it's more likely that people don't drink enough water
definitely.
and come in dehydrated, especially when you're exercising and it's hot outside and
Right.
summertime. Definitely, I'll just say I see a lot more dehydration than superhydration, I guess.
Definitely. And as far as the water in your joints, your synovial fluid, it's kind of this thick, viscous, it's kind of like the oil of your joints that's in between there. It's made up primarily of water. And if you're dehydrated, you're not going to have the joint's ability to reduce friction. It also acts as a cushion. When you come down, it's so thick. When you come down from a jumping position and you land, when your bones come together, it's actually pushing out that synovial fluid as a cushion to reduce injury there. So it's very important for joint health and muscle health. So.
What about, if somebody wanted to start doing a little bit more than, just walking, I want to start doing some strength training.
Mm-hmm.
Are there, I sometimes refer people, try to find a video online, things like that. Do you
Right.
find that there's any good resources that you sort of point people in the direction of?
I mean, the vast majority of those type of situations, we're going to be seeing them in therapy. We're going to be teaching them how to do stuff in therapy, and a lot of it you can actually do on your own at home. To work with your shoulders, ideally, you don't need a dumbbell more than 5 pounds, because by the time you get that far away from your body, your arm acting as a lever arm, there's a lot of torque going on through your shoulder, and these are pretty small muscles, your rotator cuff muscles. We teach a lot of people things that they can do at their home, using stairs, using rubber bands, using dumbbell weights, real simple things. Now, if you're wanting like a general strengthening program, you don't feel real confident about using like free weights in the gym, we have a wide variety of machines there. It's safe. You don't need a spotter to do that stuff. We can easily, towards the end, if we think that's appropriate, we'll transition you out there to use that and show you how to set it up and give you confidence by doing it 2 or 3 times with you, that you can go in there on your own and not feel self-conscious about it and not hurt yourself using that equipment. So.
Yeah, and I think most of that equipment, it has like QR codes on it that
Right.
you can scan
Right.
and watch videos of what the machine, because there's usually more than one thing that you can do with, some of those machines.
Definitely, yeah.
It's pretty user-friendly for beginners.
Right.
I'd say another thing, we've got this beautiful YMCA here at the hospital. I didn't know this until somewhat recently, but my understanding is that anybody 80 years old and over has a free membership to the YMCA.
That is correct.
And so, I mean, just these abilities for people to come in and use the equipment and learn how to do it, because you mentioned like a new step. I think sometimes for older people it's kind of like a recumbent bike,
Right.
and it puts pressure in different areas, and so
Working the arms and the legs, and it's like I said, if you have back problems, it's great because you're not compressing that spine with every step that you take. So it's a really good means to use.
And I've shared this stat before, but it was at NHA's conference, I believe, that they said that one of the greatest or one of the best predictors of longevity in life is muscle mass. So great for aging population, senior citizens.
Yeah. Bodybuilders must last forever.
I'm guessing maybe there's a law of diminishing returns, or maybe there's other substance in their body that helps prevent that longevity. So
I'll tell you what it will do, especially for women as they get older. If you're doing strength training, that stress that's applied to the bones is going to help prevent loss of bone density, and it's going to prevent you. A lot of times, it's a cascade event. You get weak, you fall at home, you break your hip, you go to the hospital, you either get infection or pneumonia, you get something, and that fall due to weakness, that broken hip, is what starts everything and leads to the end. So I totally see how that would be applicable. So.
And just the idea that, I mean, bones are living tissue, and
Right.
they do like to kind of be stressed and
Right.
worked and moved.
It stimulates
and,
the osteoblast to build more bone. So yeah, no, I totally agree. Strength training, especially for females, especially for anybody as we get older, if you want to stay out of assisted living, you want to stay out of the nursing home, that strength training is what's going to do that to help keep your function. So
I always find that it's, you can kind of get into these circular arguments. Well, geez, somebody's fallen, so they need to be careful. Maybe they shouldn't be exercising and walking because that puts them at risk. But I really think that the evidence does kind of go the other way.
Right.
It's kind of the use it or lose it.
yeah,
sort
if
of
you just sit
approach.
at home and do nothing, it's just going to get worse. And if balance is an issue, if joint pain is an issue, we can modify things so much that you can still get strengthening benefit. You can do a lot of exercises just sitting in a chair. Just a kitchen chair is all you need. You don't have to be up. You don't have to use the heavy weightlifting equipment to do this stuff. You can do stuff with weighted cuffs at home, with rubber bands, using your body weight. There's a lot of exercises you can do just to help maintain that stuff without putting you at potential risk for falls. Or if you're at home and you can't drive, or it's really difficult to get up to a place where you can work out. So, and all of the home exercise stuff that we give them as far as programs, it can be modified or adjusted so that you can do it at home safely. So
I think that's really important to mention, because I think it can be, again, this circular argument. Gee, my knee hurts, and doc, you're telling me to go out and exercise. Well, if my knee didn't hurt, I'd be able to exercise.
Right.
But there is this idea that find something that you can do. If you can't find something, I think working with physical therapists are so great, because you guys do have this experience of, okay, try it in the water. Let's try this.
Right.
Here's a different machine. Gosh, if this is putting pressure on your knee and you don't like that, let's try a different approach to
Right.
where we can kind of protect the joints that are bothering you and focus on the stuff that's of interest. And just general strength training, as you say, even if it's not just that joint,
right.
getting the whole body going.
Or if it's a knee that does need to be replaced, if we've gotten to that point, if you were willing and you're cleared to do so, get your joint replaced. You can get back to doing those activities. So if that's what's prohibiting you from doing that stuff, so.
yeah, and maybe I'll make a plug here.
Okay.
For the last 2 years, we've had best in the region surgery department.
We have a great surgery
We do total joint procedures here at the hospital.
Yeah.
Talk about kind of, because I always think this is a really interesting question. I've just had some parents that have had joint replacements, and so kind of the question that I get in clinic, and I'm sure you get, Craig, as well, when should I do this? How much is, what's the point where I do start thinking about surgery? Gosh, I've been doing exercises, I've been doing physical therapy, but my knee still hurts.
Right.
How do you talk to people about that?
Well, primarily it's hard to say. I know that they don't like to do joint replacements on people that are under 50 generally. Sometimes it's above or below that, but they don't want the components. You're like a knee replacement is made up of metal and plastic components, and if you wear those out, then you actually have to have those components replaced again, and they don't want to really do that unless they have to. But a big indicator, I was working with a gentleman, he had severe arthritis, osteoarthritis in his shoulder. He was almost in his 90s, and he said, "I am miserable. I cannot sleep at night. It's so uncomfortable." He said, "I'm going to get this replaced, regardless of how, the risks or whatever." He goes, I'm not enjoying my life anymore. And I don't know if you want to wait till it gets to that point. I'd say for the most part, if you can perform most of the activities that you want to, and you're satisfied with your activity level, and you're not in excruciating pain, I'd say put it off for a little bit. But if it's getting to the point where it's prohibiting you from doing the things that you really want to do, that you really enjoy doing, and you're just not enjoying life, then I think you need to strongly consider it.
That's again just this very practical approach, and that's one thing that I think is nice about orthopedics, is that it really is focused on what's your experience. Can you do the things that you want to do?
Right.
And let's try to get you to a point where you can hopefully do those things. And so I always think it's interesting, the answer to when should I replace this joint often is, well, is it bothering you that much? Or,
right.
You get to the point where, gee, the pain and the trouble that this is causing me is
right.
enough that I'm willing to take some other kind of action.
Yeah.
And it's interesting that that's kind of what it is. There's not a test.
No.
It's not based on an X-ray. It's not
right.
a CT. It's not a blood test. It is, what is your experience with it?
Right. And there's people I've worked with. It's so individual. There's people that I've worked with. I want to go play with my grandkids. I want to be able to play in the backyard with my grandkids. And then there's other people like, yeah, my knee's uncomfortable, but I can do 95% of what I want to do, so I'm fine. So in that case, if we can help you out a little bit with exercises and show you some things to do at home, and you can at least maintain that functional level for a while, and you're happy with it, great. But if you're sitting at home saying, man, I wish I could go out for a walk, I wish I could play with my grandkids, I wish I could participate in these activities, and I feel like I'm just trapped in my house, get it done. If you're appropriate, get it done. I think most people that I've worked with are very happy once the pain of the surgery is over, are very happy with the outcome once they've gotten rid of that arthritis pain in their knee. So yeah.
And physical therapy tends to be a big part of joint replacements.
Definitely.
We talk about rehab. I've heard of the concept of prehab, which
Prehab,
I think
right.
is a neat one.
We've had people, especially people that are really inactive. They haven't been doing a whole lot. Their muscles are very weak. Their joints might be stiff. We do things to help get that tone back, that strength back, get their range of motion back as good as possible prior to the surgery. Then once they do start doing activities after that joint is replaced, the speed, the level of pain, the recovery process, it all just moves so much faster. So definitely doing prehab with that. We see people preoperatively, they come in, it's what you would consider joint camp at some hospitals, but these are people that are coming in prior to their surgery, primarily for educational purposes. We're going to talk to them about the assistive device that they're going to need after the surgery. If they have it there, we fit it to them or show them how to fit it to themselves so that they have an assistive device after their surgery. We show them postoperative therapeutic exercises. A lot of times when you wake up after surgery, you're kind of groggy from anesthesia and what other medications they've given you for pain or whatnot. Kind of difficult to understand what we're asking you to do when we want to do therapy in your room. We go over and see people the same day that they have surgery. So that learning process is a lot better if we educate them in what we're going to ask them to do later on. We also ask them about their home environment. Do they have stairs? Do they have somebody at home that's going to be able to help them? Do they have a railing? Do they have a toilet seat riser? If you've had a hip or knee replacement, that's often really important functional need at home that people kind of forget about. But so we do see them preoperatively, usually for one visit. Now, if it's a severe physical or range of motion limitation, we might work with them for 2 or 3 weeks before, if it's actually doing therapeutic exercises and stuff with them. But primarily it's education, getting them ready, and it helps ease some of their nerves prior to the surgery. I think they know I'm prepped, I'm ready, I know what's going to happen. They ask us questions about the surgery, about the therapy, about how fast the recovery process is going to be. So I think it really helps put them at ease too. So it's a good thing.
Mm-hmm. The other place that I see people benefiting so much from physical therapy is people who've been in the hospital for some medical reason. They're sick, they're sitting in the room, and tend to lose muscle mass and become deconditioned. I mean,
right.
I've read that for every one day you're in the hospital, it may take a week for your body to recuperate from that.
Yeah.
And, it's even if that ratio isn't quite right, the idea that illness really can take a toll on your body.
Right.
Talk to us about, sometimes at the hospital we use something called a swing bed, or gee, you've been in the hospital for a medical reason, or maybe you've had an orthopedic surgery, but you continue to, not quite be in the position where you can go home and be successful the way you were before.
Right.
So we have this program called the Swing. Andrew, you can probably talk a little bit about what the swing bed program is, and then Craig, tell us what you do to try to strengthen people who have had other medical problems or just general deconditioning.
Sure.
Yeah, so swing bed, 90+% of the time are Medicare age folks who have had a 3-night stay inpatient, and they qualify for a swing bed. They're not ready to go home or their next destination. They just need a little help.
You may not need antibiotics anymore, but
Right.
you're still not doing,
You got to get stronger. You got to be able to have the strength or whatever the issue is to be able to independently go back home or a nursing home or wherever that next level is for you. That's what swing bed is, and it's a great resource for people who are residents or local to the area. To maybe they come from a bigger facility, like maybe they were in Kearney or Lincoln, or they can come back home, maybe not to their physical home, but at least to their community, to get that extra level of care. And therapy is a big part of that.
Definitely. I always try to explain, the difference between a patient that's in the swing bed is primarily they have potential. They have a lot of potential. So it's, if for the individual that, maybe they were coming from a nursing home environment or an assisted living and they were only walking 10 or 20 feet per day, and they're doing that now and their transfer level is the same.
Yeah.
If they're back to where they were, generally that's not going to be a great swing bed candidate. You're going to try and ship those people to whatever facility they were at. If you're coming here, you've had a joint replacement, a car accident, something like that, you just need, I would say our swing beds are here for maybe 1 to 2 weeks. Sometimes it's more than that. But it's people that are going to improve rapidly with therapy. And so we're going to go in and see them, maybe they're overcoming some condition. But so you're going to go in and see them. You're going to evaluate them, try and find out whatever deficits they have. You're going to talk to them about their home environment, talk to their families, try and work on getting them back to walking a distance that they're going to need to be able to return to home, strengthen their legs to go up and down stairs if they have 5 or 6 steps leading into their home, making sure that if they're going to be on their own, that their balance is safe, their transfers getting in and out of bed, they don't need assistance, they can easily get to the bathroom, things like that, real basic needs that you're gonna need in order to get home. And then once they get home, sometimes they'll be a home health candidate. Therapists or nurses will come to their house and take care of them. Or if they're doing really well, or if they have somebody at home that's a caregiver, they can actually just proceed to outpatient services and just see us on an outpatient basis at the clinic. So,
And I mean, this is a program. I think so many people have this desire to be back at home and in their own environment.
Definitely.
And sometimes at the hospital, when I'm no longer giving somebody an IV antibiotic or they're not getting some acute medical treatment, it becomes really difficult to keep them in the hospital. But
Yeah.
we still know they're going to benefit from strengthening, and they're not quite ready to go home yet. So it serves as kind of, as you say, a transition to really try to get people home. And I just think that's so patient-centered and really, at the heart of what people want.
Right.
And so I just find that I really appreciate what you guys do
Well,
on behalf of
thank you.
patients and what you can do to try to get people home and achieve their goals.
right.
Yeah.
Right. So, no, it's a good thing. I'm glad to be a part of it. We have a great swing bed program here. We had a lot of success stories. Patients that we were kind of on the edge. Do they have potential? Do they not? But they had the right attitude, and they were willing to work for it, and got back to home. Great stories, though. So.
I bet you see a lot. Whether it's young people recovering from an injury or people getting back to where they were and in their own setting.
Yeah, that's
really great.
that's why I love my job. It's the process. It's the process of seeing somebody that's had a major setback,
Yeah.
trying to figure out the puzzle pieces, implementing therapy into that, and helping them along the way, helping them with their frustrations, getting rid of roadblocks. I love the process of trying to help people get back to where they were. So that's why I went into this. So.
I mean, I don't know, Craig. The longer that I do this job and see people in clinics struggling with bones and joints, physical therapy is such an important tool.
Yeah.
I mean, we gotta strengthen our own bodies. I become more humble about the degree to which medicines or surgery can always fix things, but I don't know. With therapy, it's never an immediate fix.
No.
But there's usually some improvement that everybody can make.
Yes.
And if it's strength, if it's balance. I get really concerned about people's poor balance in clinic, especially older people. You know, gee, my eyesight isn't what it was. I don't hear all that well. I maybe have a little, this foot doesn't quite work as well. And so
Right.
people become real setups for falls.
Yes. And there's so many different components to that. It could be neuropathy in their feet. They can't feel where their feet are. Maybe it's arthritis. Maybe it is weakness. Maybe they're just not active enough. And when they do have an episode where they lose their balance, they're not able to self-correct for that. But there's a lot of different components. Medicine is a big part of that, and therapy is a big part of that. But it's great. What I like most about therapy is it actually helps put their care back into their own hands if they're willing to. They can do some things on their own to improve themselves. So if they have the right attitude, generally most patients we can improve with that. We have a good balance program over at our clinic. We have computerized balance testing. People that are concerned about falls, or if a physician has a concern, they can send them over and we can do a quick screening. It'll tell us whether you're falling into the category that's high likelihood for falls, and if you are, then we can implement a therapeutic program to help address those deficits and prevent that from happening. So.
And I think that's the kind of thing, you know, sometimes people will come and say, I'm concerned about my balance, I'm falling. Sometimes we're asking people the questions in clinic because we know it doesn't always come up. And one of the visits where this happens is something called the Medicare annual wellness visit. And that just kind of is an opportunity for us to screen for a lot of this stuff that may or may not come up organically, but probably has some influence on how people's lives develop. And one of the major questions are in this annual wellness visit. One of the things that we do is the get up and go test.
Right.
Can you explain the get up and go test, Craig?
Well,
I'm sure you know some of this.
Are you talking about the timed up and go? Is that what you're saying?
Yes,
Yeah. So basically, we time you. We call it the tug test. Is that the same as what yours is?
Yes. So the
Okay,
idea that
yeah.
we're seeing from a seated position in a chair,
Right.
Can you stand up?
Stand up.
Ideally without using the armrests.
Right, and we time it. You walk a certain distance, turn around, come back, and sit down, and then based off that time, it will determine, you know, your likelihood of falls or your independence and functional mobility. So yes.
Yeah, and just interesting how these little screens, you can really learn a lot by just that, you know, can you get up out of a chair on your own propulsion?
Right.
Some people find it really difficult to do, and they're excellent candidates for therapy.
Yeah.
Because if you can keep people a little bit stronger and a little bit less likely to fall,
Right.
that can be a huge win for somebody in their whole life.
We've had so many success stories of people that are not very physically active. They thought, you know, when they retired, they were just going to kind of take it easy, and all of a sudden they're at a crossroads right now where they might not be able to stay at home by themselves, but they've gotten a referral, come over to therapy. We've gotten them strengthened with a program, and we transitioned them to the Y. And I can't tell you how many of these people that I don't think they would have come to the wellness center on their own if they hadn't had that intervention to do that. But they become regulars there. They're going 2 or 3 times a week. You see them out there. It's great. And they're staying at home by themselves. So.
Yeah, and I forget the exact percentage, but that was one of the biggest pushes of having the YMCA co-located in the hospital is patients who do their rehab in that gym, meaning the YMCA gym.
Yeah.
I forget the percentage. It's a high percentage. They were much more likely to continue
Right.
the program.
Just the familiarity with the equipment. And
Yep.
So, and it's great. It's got a walking track, 1/10 of a mile, I believe is what it is. And it's got a large swimming pool, and it's kind of a graduated depth. So we tell people over there that, you know, they may not feel like they're confident swimmers. Get in the shallow end and just walk. Just walking in with the buoyancy of the water, it's going to take away a lot of the pain from your arthritis. And like I said, the resistance of the water applied to your extremities while you're moving is great strengthening exercises. So you don't have to know how to swim to use the YMCA. So it's great.
This has been very interesting. Craig, we really appreciate you coming and being our first inaugural guest on the public version of
special.
this.
Yeah.
Well, they say if you're going to fail fast, so we figured we would invite Craig.
Thanks, buddy.
That is definitely not the reason. But really, the stuff about staying well hydrated, stretching, just finding some basic exercises that you can
Right.
do and continue to do them. And if you're not successful, find somebody like you, Craig,
Well,
who can
yeah,
help,
we'd be
help
glad
get
to-
Can
you
I
sorted.
throw one more thing out there?
Sure.
We were, we've talked a lot about like working out in the gym and body weight exercises. To the people out there that maybe that's just not going to be their jam. They're not going to come into the Y. They're not going to buy dumbbells to be at home.
Mm-hmm.
The main thing is being physically active, right?
Right.
Start a garden.
Yeah.
Walk Lake Helen.
Right.
It's not going to look the same for everybody. Is
Right.
that a fair?
Definitely. I just, I always am concerned about just saying, get out and go start walking, because like I said, it's not necessarily, but the next time you see your doctor for a physical or if you have a concern, like you've had a low back surgery, or if you've had, arthritis in certain joints and whatever, talk to your doctor, or stop by and talk to a therapist at the clinic. We'd be glad to give you 5 minutes of advice on some of that stuff. But yeah, if you're able to and you can do that without pain, sure.
Yeah.
Yard work, walking, just stay active.
Find your thing.
Definitely.
Find your thing.
Yeah.
Yep.
And if that doesn't work, find something else.
That's right.
Right.
Keep trying.
Right.
Yeah, just keep trying. I mean, I think, yeah, or you do something for a while and you decide I want to do something else, do something else.
Right.
Just
Get off the couch. Yes.
The couch is not the correct answer
Right.
to this question.
That's right.
Something other than that.
That's correct.
All right.
Good. All right. So things that people can do if you're feeling like you have problems with a joint or balance, yeah, talk to your doctor, make an appointment. For people who are over 65, these Medicare annual wellness visits, that's an opportunity for us to screen for these sort of things. So make an appointment for that sort of thing. It's not just screening for this, but screening for lots of different things that don't always come up. And I don't know, Andrew, don't you think listening to our podcast would be another great way to
Well, I hope so.
help try to protect and
Right. Maybe while
protect
you're
your
walking.
health?
While you're walking, listen to the
thanks.
podcast.
That's right.
Yes.
Podcasts are mobile.
Right.
You can do it anywhere.
Yeah.
Walking around Lake Helen,
Yes.
listening to this podcast. We hope that's how it's being consumed. If it is, good for you.
Yeah. Craig, seriously though, thank you for
Yeah.
joining us.
This is
we
fun.
appreciate it.
So
Yeah,
good
we appreciate
conversation.
everybody listening. We're going to try to do this quarterly, and gosh, Craig, I don't know if we can have you back next time, but it's been
no,
really fun.
it has been fun. I've never done this before. I thought it was going to be weird, but it was fun.
Yeah.
It was
Nice.
good.
I like a little weird, a little. That's kind of what we go for.
We keep it weird to the internal podcast.
Keep it weird. That's right.
Okay, well, thank you everyone for joining us and listening, and reach out if you have any questions.
We'll see you next time.
All right.
See ya.
Bye now.
Like.
Bye bye.